Hi, my name is Maggie Ciolino. I graduated from Regina High School in 2015. From there, I went to the University of Michigan, where I graduated with a major in psychology and a minor in crime and justice. I now live here in Des Moines, Iowa, where I'm a first-year osteopathic medical student at Des Moines University. And today, I'm just going to take you through a day in my life as a medical student. Let's get going. So here's a quick look at my school. This is the Student Education Center, where I spend most of my time in lecture and in the library. And then next you'll see Ryan Hall. I'll be taking you in there later to see our anatomy lab, as well as our SPAL rooms where we do our OSCEs. And then here is our clinic where a lot of our professors also work and see patients. So let's go ahead and go into the Student Education Center. So my mornings usually start with arriving on campus around 7:30 in the morning. It's pretty empty today as it's a Sunday and we're in between exams right now, but if I'm hungry, I can stop for breakfast or lunch at our cafe. And then just outside our cafe, there's a place to study or to eat. Here's a quick look at our lecture hall. It's pretty big. This is where we do lectures as well as take our exams. And then our library upstairs. I do spend most of my time here, but it's usually in these study rooms in the library. So most days I go to lecture from 8 a.m. to noon in the morning, so 4 hours of lecture, and then once or twice a week I might go to lab in the afternoon. I'm in 3 different labs and I'll be able to show you a little bit of what we might do in lab later in this video. I'm currently in 9 different courses, so lectures day to day look a little bit different. I might go to lectures in physiology, neuroanatomy, or microbiology, as well as clinical medicine or osteopathic medicine on any given day. After lecture or lab, I usually go straight up to the library to study, especially if it's the week before an exam, and I'll spend 8 to 12 hours up there in a study room. For me, studying for each course might look a little bit different depending on what the material is, so I can show you my neuroanatomy notes here. I'm watching lecture online as well as handwriting my notes out and labeling diagrams. But for my microbiology course, I wanted to make a table with all the bacteria and what kind of diseases they might cause. Here I am getting ready for anatomy lab. So I remember in high school doing the fetal pig dissection as part of anatomy, but now in med school, we are doing a full human cadaver dissection with bodies that have been donated to us. I will take you in to meet our anatomy lab specialist as well as take a look inside the lab.
How's it going, Maggie? So for you students, my name is Ariel Gubatina Jr. I am the anatomy lab specialist here, so I am staff as well as faculty. Students like Maggie come in here if they have any questions regarding any of the content, and there's things that we could address here in the office, whether it's using some of our traditional text. If you could see over there, there's some models available if we wanted to refer to those, or things to look up on the internet. But sometimes they do have questions inside the lab, so we'll go ahead and we'll give you a sneak peek into that right after this. So welcome to our faculty space when it comes to the lab. This area is actually excluded to students. This is, as you can see, where our faculty and our TAs will dress out. You can see much of the supplies that we use that maybe students could check out. So we'll go ahead and we'll show you the lab. If you look right here, you can kind of see where our donors are held who have donated their body to the knowledge of medicine. If you do a little bit of a quick zoom, you can kind of see that there are students in there studying right now. We are trying to reserve it in the space where you do not see any of our donors to honor their family and their wishes. But we do have the donors open during lab times. Over here, we'll go ahead and we'll give you a breakdown of some of those specifics. You can see we have our gloves here, our protective eyewear of different kinds. You can see that we have our dissection tools here when we do want to reveal those structures we teach in the books and our PowerPoints, such as probes, hemostats, scissors, forceps, some scalpels to cut through structures, as well as some heavier machinery such as a striker saw that we use to cut them up.
So another lab I might go to throughout the week is for my osteopathic manual medicine course, which takes place here. And this is what really sets apart DO schools from MD schools, using our hands to diagnose and treat dysfunctions in the body that might be causing or contributing to medical concerns. So my friend Maggie here, you can see her anatomies or hip bones are a little bit uneven. So I'm diagnosing that and then zooming through a quick treatment as well. So you can see I'm treating her dysfunction, and then as always, you want to check your work. Here I'm diagnosing Maggie's posterior rib, or a rib that sticks out a little bit further in the back than the rest, and then I'll treat that with a different technique. And in lab, you could actually hear an audible popping sound that the rib made that didn't come through on the video. Unfortunately, our clinical medicine lab was locked, so I can't bring you in there, but that's where we go to practice some of the clinical skills that we might do on you when you go and visit the doctor. So my friend Harold here is letting me practice his hearing. So I do the Rina test, and then I do the Weber test to test for different types of hearing loss that a patient might have. Lastly, I just wanted to show you our SPAL rooms. So this is where we go to be tested on our clinical skills in an objective structural competency exam, or an OSCE as we call them. These exams are meant to mimic a real patient encounter. So the room is set up just as any doctor's office might be, and we are recorded to review our skills later. You can see that I'm dressed up in my white coat and business wear with my stethoscope, ready to go to an OSCE here. That's all I have. So thank you so much for joining me for a day in my life as a med student.